In this video, we are going to discuss cognitive disorders of the children. At the end of this presentation, the student will be able to define visual and hearing impairment in Down syndrome and list causes, signs, and symptoms of the above cognitive disorders. Discuss medical diagnosis and treatment for these mentioned disorders. Make nursing diagnosis and nursing interventions for the above disorders. Vision impairment. Vision impairment is defined as a limitation of one or more functions of the eye or visual system. The most common vision impairments affect the sharpness or clarity of vision, visual acuity, the normal range of what you can see, visual fields, color, causes of vision impairment, genetic conditions, maternal infections during pregnancy, rubella, cytomegalovirus, consequences of disease, diabetes, glaucoma, trachoma, birth complications, trauma, poisoning, and tumors. Diabetic retinopathy, aging and age-related conditions such as macular degeneration, cataracts and optic nerve atrophy. Signs and symptoms: double vision, cloudy or blurry vision, difficulty in colors, differentiation, difficulty reading or watching TV, strabismus, poor vision, unequal size of pupil, difficulty in focusing, frequent blanking. Diagnosis: simple tests that an ophthalmologist may perform include visual acuity test. A person reads an eye chart to measure how well he or she sees at various distances. Visual field test. Ophthalmologists use this test to measure side or peripheral vision. Tonometry test. This test determines the fluid pressure inside the eye to evaluate for glaucoma. Treatment: an eye condition that is likely to cause visual impairment, so by treating the condition can reduce incidence of visual impairment. Options may include eyeglasses, contact lenses, and eye drops or other medicines. In some cases, surgery may be required. For instance, cataracts are often treated by removing the clouded lens and replacing it with an intraocular lens. Nursing diagnosis: risk for injury related to impaired vision, risk for ineffective family coping related to child's prolonged disability from sensory impairment, risk for altered growth and development related to impaired vision, sensory perceptual alteration related to altered reception, transmission, and integration resulting from retinopathy. Provide kinesthetic, tactile, and auditory stimulation during daily care. Evaluate environment for potential safety hazards. Eliminate safety hazards and protect child from exposure. Assess growth and development to identify the child's strengths and needs. Provide explanation of visual impairment as appropriate. Assist parents to plan for meeting developmental and safety needs of their visually impaired child. Hearing impairment. Hearing impairment is the decreased ability to hear and discriminate among sounds. The level of impairment can vary from mild to severe or total loss of hearing. It is one of the most common birth defects. Hearing impairment may be congenital hearing impairment or acquired hearing impairment. Types of hearing impairment: conductive hearing impairment, sens- senso- sensory sensory neural hearing impairment, mixed hearing impairment, ear anatomy. This is the pinna, you know, this is pinna, here is pinna, this is called pinna, and this is, these are the ossicles. These are what? These are the ossicles. Okay, these are the ossicles. And this is here eardrum. Okay, this is middle ear. This is auditory nerve and cochlea. These are all things that I hear. Etiology: congenital causes, maternal rubella or certain other infections during pregnancy, birth asphyxia, severe jaundice, زي لك زي شاب زي congenital causes, maternal rubella or certain other infections during pregnancy, birth asphyxia, severe jaundice in the neonatal, birth asphyxia, severe jaundice in neonatal period. Acquired causes: infectious diseases such as meningitis, measles and mumps, chronic ear infection, otitis media, head injury. Signs and symptoms: infants, older children. Infants: failure to surprise at loud sounds, not turning toward the sound of a voice at about 6 months of age, lack of babbling by 12 months of age, failure to respond to name by 12 months, not using single word by 18 months of age. Older children develop vocabulary more slowly than their peers, often ask for words to be repeated, turn on the TV too loud, appear inattentive at school and have trouble learning to read. Poor hearing. Diagnosis: newborns and infants, automated auditory brainstem response test, acoustic emissions test. Older children, auditory whisper test, Rance test, Weber's test, Watch test. Treatment: a child with hearing impairment should begin receiving treatment before 6 months of age. Treatment options are available: hearing aids, cochlear implant, surgery. Nursing diagnosis: sensory perceptual alterations, auditory related to hearing loss, impaired verbal communication related to congenital hearing impairment, risk for activity intolerance related to hearing loss and impaired verbal communication. Nursing interventions. Label the patient's chart so all hospital personnel are of her hearing loss. Ask the patient what communication methods work best for her. Face the patient and get her attention for before speaking. Check that hearing aids are in place and batteries are functioning. Talk with patient without wearing a mask. Down syndrome. Down syndrome, also called trisomy 21, is a condition in which extra genetic material causes delays in the way a child develops, both mentally and physically. It affects about 1 in every 800 babies. Down syndrome is named after John Langdon Down, the British doctor who first described the condition in 1887. It was not until 1959, however, that an extra chromosome was identified as the cause. Etiology: caused by non-disjunction of the 21st chromosome. This means that individual has a trisomy 3 to 21 chromosomes, Down syndrome 21. Okay, this you can see. Clinical features: small ears that fold over at the top, small flattened nose, small mouth making tongue appear large, short neck, small hands with short fingers, low muscle tone hypotonia, single deep crease across center of palm, loosens joints, delayed closure of fontanelles. Clinical features: delayed eruption of teeth, small skin folds at the inner corners of the eyes, excessive space between the first and second toe. In addition, Down syndrome always involves some degree of mental retardation, compromised immune response, congenital heart diseases. Diagnosis: characteristics, clinical features. Diagnostic test during pregnancy includes chronic villus sampling (CVS) sample of the placenta either through the cervix or a needle inserted in the abdomen. Amniocentesis: removal of a small amount of amniotic fluid through a needle inserted in the abdomen. Percutaneous umbilical blood sampling. This is okay. Percutaneous umbilical blood sampling. This test uses a needle to retrieve management. There is no known treatment for this disorder. Therapy is directed towards specific problems. Antibiotics for infection, digoxin, or cardiac surgery for heart problems. Support for parents and family advice is important. Nursing diagnosis: potential for injury due to poor vision, hearing, and hypotonia. Potential for infection related to increased susceptibility for illness secondary to compromised immune system and heart disease. Activity intolerance related to cardiac condition. Self-care deficit related to inability to do ADL due to hypotonia. Nursing interventions: assess for associated problems, administer medications which may be prescribed for associated problems, avoid exposure to infection, assists infants in feeding because feeding difficulties occur due to a protruding tongue and hypotonia, encourage fluids and foods rich in fiber because constipation results from decreased muscle tone, provide good skin care because the skin is dry and prone to infection. Cerebral dysfunction in children. Bacterial meningitis. It's an inflammation of the meninges. Etiology. Variety of bacterial agents. Haemophilus influenza, Streptococcus pneumoniae, and Neisseria meningitis organisms are responsible for 95% cases of children older than 2 months. Other organisms are beta hemolytic Streptococcus, Staphylococcus aureus, and E. coli. Meningococcal meningitis occurs in epidemic form and is the only type readily transmitted by droplet infection from nasopharyngeal secretions, common in school-age children and adolescents. Pathophysiology. Upper respiratory infection or penetrating wound. Pathogen proliferates. The organism entered into the CSF by which the infection spreads into the subarachnoid space. Meningeal inflammation. Ineffective process takes place. Inflammation exudates. WBC accumulation and tissue damage. Brain becomes hyperemic and edematous, and the entire surface of the brain is covered with a layer of purulent exudates. An infection extends to the ventricles. Thick pus, fibrin, or adhesions may occlude the narrow passages and obstruct the flow of CSF. Possible hydrocephalus and cranial nerve palsies. Cerebral edema. Clinical manifestations: fever, chills, headache, and vomiting. Alteration and sensorial seizures. Initial sign: extremely irritable, photophobia, delirium, hallucination, coma. The neck stiffness, knuckle rigidity, Kernig's and Brodzinski signs are positive. Skin may be cold, cyanotic with poor perfusion. Diagnostic tests: lumbar puncture test, glucose decreased, protein increased, WBC increased, blood culture sensitivity, CBC, nose and throat culture. Therapeutic management: initiation of antimicrobial therapy, cephalosporin, maintenance of optimum hydration, maintenance of ventilation, reduction of increased ICP, dexamethasone, management of bacterial shock, control of seizures, epival, phenobarbital, phenytoin, control of extremes of temperature, treatment of complication, nursing care. Observe child for signs of increased ICP, intracranial pressure, shock or respiratory distress. Head circumference is measured in the infant. Fluid and electrolyte are determined by the child's status. Child with altered GCS is usually kept NPO, nothing per oral, or can be given clear liquid and then gradually start on regular diet. Emotional support to parents. Encephalitis. It's an inflammatory process of the CNS which involves meninges as well as brain tissue and spinal cord. Causes: variety of organisms, bacteria, spirochetes, fungi, protozoa, helminths, and viruses. The majority of cases of known etiology are associated with the childhood diseases of measles, mumps, rubella, varicella, and less often with the enterovirus and herpes virus. Pathophysiology: direct invasion of virus through bloodstream or peripheral nerves, infect the blood, extensive viremia, CNS infection. Clinical manifestations: fever, headache, irritability, respiratory symptoms, stiffness of neck, ataxia, tremors, speech difficulties, seizures, increased ICP and coma. Diagnostic tests: history, CSF test, viruses of herpes, mumps, measles, enterovirus may be found in the CSF. Normal glucose, slightly increased protein, increased WBC, CT scan, hemorrhagic areas in the frontotemporal region. MRI shows cerebral edema, hydrocephalus. Brain biopsy. Treatment: supportive nursing care, control of the cerebral manifestations, adequate nutrition and hydration, close monitoring with Glasgow Coma Scale, mechanical ventilation, ICP monitoring, anti-epileptic drugs, Epival, phenobarbital, acyclovir, IV for herpes simplex encephalitis. Nursing care: observe child for signs of increased ICP, shock or respiratory distress. Head circumference is measured in the infant. Fluid and electrolytes are determined by the child's status. Child with altered GCS is usually kept NPO or can be given clear liquid and then gradually start on regular diet. Emotional support to parents. Hydrocephalus is a syndrome or sign resulting from disturbance in the dynamics of CSF. Is a condition caused by an imbalance in the production and absorption of CSF in the ventricular system. Types: communicating, impaired absorption of CSF within the subarachnoid space, ventricles communicate; non-communicating, obstruction to the flow of CSF within the ventricles don't communicate. Pathophysiology: imbalance of secretion and absorption of CSF, accumulation of CSF in the ventricles become dilated, enlargement of skull. Etiology: developmental malformation, neoplasm, infections, trauma. Diagnostic tests: head circumference, CT scan, MRI. Therapeutic management: surgery, removal of obstruction, tumor, cyst, shunt procedure and medications. Shunt, VP shunt. Complications of VP shunt: infection and malfunction, mechanical problem, kinking, bludgeoning, separation of tube, subdural hematoma. Nursing care: position on unoperated site. Pain management: observe for signs of increased ICP, neurologic assessment, vital sign monitoring, monitor IV fluids, monitor for signs and symptoms for shunt infection. Head injury: head injury is a pathologic process that involves the scalp, skull, meninges or brain as a result of the mechanical force. Head injury is a leading cause of death in children younger than 1 year of age. Etiology: falls, motor vehicle injuries, infants often left unattended, incomplete motor development. Pathophysiology: exposed nature of the head, external violence, force of impact, intracranial contents or damage, severe scalp laceration, bleed to death. Clinical manifestations: confusion and depression, dizziness or balance problems, blurred vision, feeling tired, headache and sleep disturbance, memory loss, nausea, sensitivity to light or noise, trouble concentrating. Diagnostic tests: CT scan, X-ray, MRI. Therapeutic management: analgesics may be used for pain relief and pain management. Anti-anxiety agents may lessen feelings of uncertainty, nervousness, and fear. Anticoagulants may be used to prevent blood clots. Anticonvulsants may be used to prevent seizures. Antidepressants may be used to treat symptoms of depression. Nursing care: GCS, VS at repeated intervals, place the child on bed rest, protect from injury, observe position and movement of child, observe for seizure activity, neurologic examination. Epilepsy: epilepsy is a chronic seizure disorder with recurrent and unprovoked seizures. Seizure disorder: seizures are brief malfunctions of the brain's electrical system, involuntary contractions of the voluntary muscles. It's the most commonly observed neurological dysfunction in children and can occur with a wide variety of conditions that involve the CNS. Classification: partial seizures, generalized seizures. Etiology: idiopathic. Congenital defects and genetic disorders. Higher incidence of seizures among relatives of children with idiopathic seizure disorder. Acquired brain injury, trauma, hypoxia, infections, toxins, biochemical hypoglycemia, birth injuries, intracranial trauma, hemorrhage, and acute infections of brain. Pathophysiology: spontaneous electrical discharge initiated by a group of hyperexcitable cells referred to as epileptogenic focus, increased electric excitability in response to any of a variety of physiologic stimuli, cellular dehydration, electrolyte imbalance, abnormal blood sugar, fatigue, emotional stress, and endocrine change. Neuronal excitation spreads to brain stem. Generalized seizure. Diagnostic tests: thorough history, any factor that have precipitated the seizure, a complete physical and neurological examination, CBC, lead poisoning, infection, lumbar puncture, CS infection or trauma, MRI, skull abnormalities, EEG. Therapeutic management: the objective is to control the seizures or to reduce their frequency and severity, discover and correct the cause when possible. Anti-epileptic drugs. Nursing care: remain calm and stay with the child. Provide time for recovery after seizure stops. Reassure and provide support to the child and others. Speak softly to reduce agitation or confusion. Acknowledge if the child is having altered sensation or perception. Avoid restriction of movements during seizures. Remove harmful objects away from the child. Place a soft material under the head. Don't give anything to eat or drink during seizures. Thank you very much. This was all about pediatric health nursing.